Hello guys, welcome to this audio session of anemia. I am Suraj and let's start with the discussion. What is anemia? Anemia can be defined as the qualitative or quantitative diminution of RBC or hemoglobin concentration or both in relation to the standard age, sex and geographical locations and is clinically manifested by pallor. The cardinal sign of anemia is pallor. It is not a disease but denotes the manifestation of some diseases. So thus a cause must be searched for. Anemia is commonly associated with various hematological and systemic disorders. Where will you look for anemia? The sites are to be examined in a good natural light. The lower palpebral conjunctiva. Retract the lower eyelids downwards and ask the patient to look upwards, both eyes at the same time. In health, palpebral conjunctiva is red, which appears to be pale pink in anemia. Number 2 side, tongue, especially the tip and the dorsum of the tongue. Number 3, mucous membrane of the palate, especially the soft palate. The soft palate manifests the earliest anemia. Nail beds. Press the pulp to see the redness of the nail bed. Nail beds are the windows of cutaneous capillary network. Palms, soles and generalized skin surface. Other areas like rectal or vaginal mucosa may be examined for anemia, but they are not practiced clinically. What are the clinical types of anemia, and it helps in bedside assessment? Anemia is clinically classified as mild, moderate and severe types. It is totally a clinical assessment, highly subjective sign and may not correspond with the laboratory findings. Clinically, we see the paleness of the skin and mucous membrane or pallor. The color of the tongue as well as the conjunctiva are more reliable than other sites in that aspect in adults. In children, palms and soles are also to be looked for. How will you grade anemia clinically? Mild anemia, 60 to 80% of hemoglobin or 9 to 12 gram per dl. Moderate anemia, 40 to 60% of hemoglobin or 6 to 9 gram per dl, and severe anemia less than 40% of hemoglobin or less than 6 gram per dl. The normal hemoglobin concentration in case of males is 14.6 to 15.5 gram per dl. In case of female is 13.3 to 14.6 gram per dl. Clinically, 14.5 gram per dl may be taken as 100% hemoglobin. According to WHO, anemia in male if hemoglobin less than 13 gram per dl and in female if hemoglobin is less than 12 gram per dl. What are the causes of pallor without anemia? Pallor or paleness is the waxy appearance of the skin and mucous membrane. It depends on thickness and quality of the skin and the quality and amount of the blood in the capillaries. Thus, pallor and anemia are not interchangeable terms. There are many causes of pallor and anemia is the commonest among them. Pallor of mucous membrane is commonly due to anemia. Very often, generalized pallor is attributed to severe anemia. It is difficult to detect pallor in deeply pigmented individuals. The opposite term for pallor is plethora, that is a ruddy complexion seen in polycythemia. Anemia is a pathological condition while pallor is a clinical entity. A person without losing a drop of blood may become deadly pale like in shock and collapse. And similarly, a person looking severely pale may not be grossly anemic like in Sheehan syndrome. Facial pallor is commonly seen in vasoconstriction, shock, and low cardiac output states. The pallor is the common sign in myxedema and chronic renal failure, even in panhypopituitarism. In general survey, one may write pallor, probably a better terminology, instead of writing anemia. Mention the causes of pallor without anemia or the DDs of anemia. Number 1. Peripheral circulatory failure like low cardiac output in acute left ventricular failure, or shock like in Assengrave pallor with cold and clammy skin, or vasoconstriction due to any cause like syncope. Acute myocardial infarction, number 2. Number 3. Very tight aortic stenosis or mitral stenosis. Number 4. Myxedema. The pallor is due to vasoconstriction plus lemon yellow tint due to carotenemia plus anemia. Number 5. Nephrotic syndrome. Number 6. Sheehan syndrome or panhypopituitarism. Number 7. Vasovagal attack, fear, exposure to cold, intense emotion and increased carotenoid pigment. Number 8. Night workers. Number 9. Edematous conditions like anasarca. Number 10. Thick skin like in scleroderma. The pallor may be associated with or without anemia. The pallor with anemia is seen in all types of severe anemia, subacute bacterial endocarditis, etc. But the pallor without anemia, the causes are described above. Examinations of the hands in anemia. Color of the nail beds and palms gives an indication of presence of anemia. Koilonychia gives a clue of the type of anemia such as iron deficiency anemia. Number 3. In severe anemia, there may be visible capillary pulsation in nail bed. Number 4. Presence of splinter hemorrhage or ossular node point towards subacute bacterial endocarditis. Number 5. Presence of ecchymosis or bruise indicates the acute leukemia or aplastic anemia. Number 7. Lemon yellow pallor suggests advanced pernicious anemia. Number 8. Anemia with finger deformities may indicate long continued rheumatoid arthritis. Number 9. Knuckle pad hyperpigmentations indicates megaloblastic anemia. Next, color of palmar creases gives a clue to the degree of anemia also. When they are as pale as the surrounding skin, the patient usually has hemoglobin level less than 7 gram per dl. In ophthalmoscopy, if the retina seems very pale, the hemoglobin concentration is usually less than 4 gram per dl. The jaundice associated with anemia points towards the hemolytic anemia. If hemoglobin concentration is 81 to 99%, is it called anemia? Yes, it is anemia, but the pallor may not be clinically appreciated, so this group is not included in the clinical classification of anemia. Thus, we only have mild anemia, moderate anemia and severe anemia clinically.